Good evening. You know that expression, every little bit helps? We say it when we're talking about a worthy cause. Every little bit helps. But what happens when every little bit actually doesn't help, but actually may cause harm? Grab a seat. Let's talk about it. World War II had the greatest generation. 9/11 had the firefighters. And in this murderous global pandemic, we have Blackstone? Governor Andrew Cuomo of New York recently celebrated the modern day heroes of this giant private equity company for their generous donation.
I want to thank Blackstone for making the first contribution to that fund of $10 million to assist the first responders. I hope other individuals and corporations follow their lead.
Giving money to medical professionals? How nice. Now, some of you may argue, let's not get too excited by this generosity. It's chump change for Blackstone, with $571 billion of assets under management. It's like the median American household donating $2.62. But some of you might argue back, at least it's something, right? We're in a crisis and nurses and doctors need all the help they can get. The system is what it is. At least there's this. But what if I told you those medical professionals might be better off if Blackstone hadn't made the donation in the first place? How can that be, you ask? The short answer is that if Blackstone didn't make that donation, and if private equity firms and other companies didn't engage in similar attempts at charitable reputation laundering, we would smell their stink more clearly. Let me break it down. You see, even as Blackstone was donating to medical professionals, it was at that very moment profiting from shafting such professionals. Consider a company based in Knoxville, Tennessee, called Team Health. According to a recent report in ProPublica, this medical staffing company, which employs doctors and nurses who work out of hospitals and urgent care clinics, has in recent months been cutting back the hours and therefore the pay of their medical personnel. Now, why would they do that in the middle of a pandemic? Well, because the pandemic is having a strange effect on medical demand. Many patients are staying away from regular checkups, elective surgeries, and other ER visits. So in many facilities, the number of patients and the overall revenue may actually be going down. Meanwhile, COVID patients are coming in. They may be fewer in number, and they may be bringing in less bacon, but many require more intensive treatment. So these doctors and nurses are working as hard as they've ever worked, even doing jobs that are not, strictly speaking, their jobs. But employers like Team Health worry that the broader decline in patient volumes will hurt their revenues. So they're transferring the risk onto the backs of whom? Their employees. They're cutting back on doctors and nurses at the very moment their profession is saving so many lives. And guess who owns Team Health? The generous heroes at Blackstone. Now, if you go to Team Health for a colonoscopy, you may have no idea it's actually Wall Street up your ass. But over the last 10 years, many private equity firms like Blackstone have bought up smaller medical practice groups that contract out doctors to hospitals, especially the emergency rooms, and consolidated them into large staffing companies. So what happens when private equity firms buy up your local medical practice and smush it together with other practices? They follow a playbook detailed by the economists Eileen Applebaum and Rosemary Batt. Buy them with borrowed money. Then you got these high interest payments you got to meet every month. So you squeeze more profits out of your investment by slashing costs, cutting hours, pay, benefits, what have you. And it's not just the doctors and nurses who are being asked to bend over and cough. Team Health practices can be even more financially life-threatening for those everyday patients who might be on the economic edge. In 2019, Team Health and another private equity-backed staffing company named Envision were found to engage in surprise billing, which, not as fun as it sounds. Here's how it works. You go to your local hospital with a medical problem for which you have insurance. The hospital is in your insurance company's network, but the doctor who treats you, supplied to that hospital from one of those outside staffing firms, doesn't belong to the same network as the hospital. And guess what happens? Surprise! You get hit with a big bill for an out-of-network doctor. Team Health and Envision have more than surprise billing in common. Like Team Health, Envision, which is owned by the private equity firm KKR, reportedly made staffing cuts recently as well. SCP Health, an investee of Onex Corporation, which claims $38 billion under management, cut hours too. And all three firms have one further thing in common: the kind of generosity that distracts people from the firm's complicity in injustice. Blackstone gave those millions to New York. KKR gave $50 million to support medical workers. And a website linked to Onex reports $6,655 in Onex NY COVID-19 donations. So, to go back where I started, these donations that you might argue help at least a little, I'll suggest to you that these donations are a public display of help that allows the same institutions to harm the same people at considerably greater scale. Those donations are the flowers your spouse bought you after sleeping with your best friend, while letting that best friend wear your socks. Your socks. She didn't buy you those flowers to atone. She bought you the flowers to distract you with nice feelings so she could keep having the affair. And so it is with this kind of philanthropic reputational scrubbing. A governor who should instead be looking into these staffing practices now praises the parent company for its generosity. The press, which should be investigating the squeeze on frontline workers in a crisis or surprise billing, mostly ignores those stories while running reports on these gifts. Instead of being known for the profit extracted from doctors and nurses, private equity companies like Blackstone are cast as their saviors. The last people anyone suspects of hurting others are the heroes who have come in to save them. And we haven't even talked about the broader ways in which firms like Blackstone undermine the common good and leave our society inadequate to challenges like the coronavirus. They lobby for tax loopholes and cuts that benefit them and leave public coffers drained. When the Obama administration proposed a tax law that would have trimmed Blackstone CEO Steven Schwartzman's nearly $800 million in annual pay, he compared it to Hitler invading Poland. Yes, that Hitler and that Poland. And Blackstone's senior advisory director, William Mulrow, a longtime ally of Governor Cuomo, was recently appointed to a blue ribbon commission, guiding New York's economic recovery as the state comes out of this crisis. Cuomo relaxed state regulations of lobbying to bring Mulrow on as a volunteer, in effect making any recovery ideas that Mulrow happens to have, that just so happen to benefit Blackstone, turns those into an act of generosity. I'm going to bet that unless you're one of the affected doctors or nurses, you probably haven't heard about the cuts we're detailing tonight. The surprise billing, the tax advocacy, the lobbying either. But you may have heard about these donations. And so generosity becomes the wingman of injustice. Giving back becomes the wingman of taking too much. And making a difference becomes the wingman of making a killing.